Good morning, sir. Respected seniors, my colleagues, myself, Dr. Ankit Gulia. I am DM Cardio Resident, final year in Dayanand Medical College, Ludhiana. So this was my thesis topic to study risk factors, clinical and angiographic profile of women with acute coronary syndrome. So we know that ACS is in women is often underdiagnosed due to atypical symptoms and treatment disparities. Menopause adds unique risk like hormonal changes and pregnancy related complication. Studying these differences is crucial for early diagnosis and better outcomes. The aims and objectives of the study was to study risk factors and clinical profile of women with ACS, to study the angiographic profile of women with ACS. Materials and methods. This prospective case control study was conducted at the DMC Ludhiana from June 2023 to May 2024, including 125 consecutive female ACS patients with 125 age-matched male controls, detailed history, menstrual and obstetric factors, clinical examination, ECG, biomarkers, echocardiography, and coronary angiography were recorded using standard protocol. The result of this study, it includes all the parameters like risk factor, age, any other comorbidity, presentation time to the hospital, whether the patient presented within the 12 hours or after 12 hours or late presentation, and how many patients undergone coronary angiography, they were also included, and those who undergone procedure, this data was also taken. In the most common presentation in the male was NSTEMI, and in female it was observed in around 21% of the cases, but STEMI was the most common presentation, and among STEMI the anterior wall MI was the most common. Out of the 125 patients, if we see that loading dose was given in the 100% of the male patients, but it was given in 95% of the female. So this indicates that underestimations of the symptoms or lack of the knowledge of the atypical symptoms with the which women present. So loading dose was given in only 95% patients and 5% patients were skipped. On echo showed that there were more LV dysfunction, more valvular complications as compared to the male, indicating that women present with serious complications in ACS. Among the 100 patients, the angiography were more done in the male and less was in the females, indicating that lack of knowledge, lack of financial issues in females. Complications were more common, complications like arrhythmia, cardiogenic shock, VT, VF. This was more common in female and it was less in male. IABP use of mechanical circulatory devices was more common in female, around 12.8% female received IABP and around 4% of the male received IABP. So this diagram shows, the yellow one shows, this study also included this cohort divided into 3 parts, that there was a general data was taken from 250 patients that was separately analyzed. Then this data was analyzed between male and females for the risk factors and the angiographic profile. Then between the female, there was a substrata that includes premenopausal and the postmenopausal females to see that how the menopausal status affects or the coronary artery disease and its outcome. So the menarche history, post-menopausal history was also taken and it was compared between the females. So between the premenopausal and the postmenopausal female, the postmenopausal female, they have more acute decompensated presentation with ACS, was more with acute decompensated heart failure. Complication was more commonly seen with postmenopausal female, but the thrombolysis was more common in the premenopausal females. Contraceptive use was more common in premenopausal female, and peripartum cardiomyopathy was more common in premenopausal female stillbirth. So Stillbirth was more common in post-menopausal female. The mean age was of post-menopausal female was around 65 age. So it indicates that there was previously lack of the medical facility. Preterm delivery was more common in the post-menopausal female. Gestational hypertension and gestational diabetes were more common in premenopausal female, indicating the risk factor that these were exclusively or most commonly were seen in the premenopausal female. Normal vaginal delivery was more common in the postmenopausal female, indicating that lack of the medical services, but LSCS was more common in young female, premenopausal female. If we about the BMI, the premenopausal female were more obese as compared to the postmenopausal female, indicating as a risk factor. The women with ACS showed more RWMA, more MR, mitral regurgitation and complication, while men more often had NSTEMI. Premenopausal women carried higher metabolic risk like overweight, gestational diabetes, gestational hypertension, and greater contraceptive use. Postmenopausal women had more preterm deliveries, stillbirth, and higher rates of acute decompensated heart failure. These findings highlight worse myocardial dysfunction and in-hospital complication in women. Obstetric and reproductive history add to long-term cardiovascular risk in pre- and postmenopausal female. Conclusion: women with acute coronary syndrome face greater myocardial dysfunction and complications with risk shaped by reproductive and menopausal status. Incorporating obstetric history into risk assessment can improve prevention and outcomes. The limitation of the study was it was a single center design with a relatively small sample size, which may limit generalizability. Thank you, sir.